Let's get into the why. Why does that nerve get pinched? Well, usually it's a spinal disc issue. Think of your discs like jelly-filled donuts sitting between your vertebra. They are shock absorbers, but they are vulnerable to two main mechanical failures. Herniation, if you lift something heavy the wrong way, that jelly is going to squirt out. It isn't just a physical bump, it's chemically irritating, like pouring lemon juice on an open cut. Then there's degenerative disc disease. Over time, those donuts flatten and lose water. As they get thinner, the hallways where the nerve exits is going to get smaller. Eventually, it's a tight squeeze. The chiropractor is the master of managing these pathologies. Their benefit is the mastery of spinal biomechanics. They know exactly how to move a segment of the spine to change the internal pressure of that donut. The Cox Distraction Table is the secret weapon here. It is a specialized form of chiropractic decompression where the table gently drops and moves with your body, creating a vacuum effect. This vacuum helps suck that wandering jelly back in towards the center of the donut and opens up the nerve hallway by up to 28%. Sometimes the spine is innocent. Enter piriformis syndrome. The piriformis is a small muscle deep in your glutes. If you sit too much or have gluteal amnesia, weak butt muscles, the piriformis clamps down on the nerve like a pair of pliers. This is pseudo-sciatica. Even here, the chiropractor is vital because a tight piriformis is often caused by a misaligned pelvis. If the pelvis is tilted, the muscles are forced into a permanent spasm. The chiropractor adjusts the pelvis to level the playing field so the muscle can finally relax. Then physical therapy and massage step in. In PT, we use nerve gliding, flossing the nerve through the muscle to break up those adhesions. Massage therapy manually breaks the spasm, while shockwave therapy uses acoustic pulses to kickstart healing in deep knots. Cold laser is then applied to soothe the bruised nerve. While we fix the mechanics, regenerative medicine and peptide therapy handle the chemistry. Regenerative medicine uses the body's own healing factors to repair the worn down disc, or the ligamentous damage around the nerve. Peptides provide the blueprints for the cells to build new, healthy tissue. When you combine the mechanical space of the Cox table, the functional movement of PT, and the manual release of massage, you are changing your biology from the inside out. Whether it's a jelly donut in your back or an imposter in your glute, you need a team that knows the difference. At Oakland Lifestyle Medicine, we don't just give you generic stretch, we provide a precision-engineered recovery plan. Call us today or book online to experience the Cox Distraction Table and our integrated approach to pathology. Stop managing the pain and start repairing the damage.